Every year, 18.6 million people worldwide develop a diabetic foot ulcer. Despite optimal standard care, 60 to 70% fail first-line treatment. That failure rate translates to 2 million amputations globally every year, with ulceration preceding 85% of those procedures. This comparison shows the lethal stakes. The 5-year mortality rate following a diabetic foot ulcer ranges from 30 to 49%, a figure comparable to many severe cancers. The burden is systemic. Pressure ulcers cost $26.8 billion annually in the U.S., while venous leg ulcers carry a 70 to 80% recurrence rate. Advanced wound care is facing a biological wall. We are losing limbs because current treatments fail to address the cellular environment of chronic wounds. To understand why healing stops, we have to look at the microscopic environment. Chronic wounds are trapped in a self-destructive cycle called the proteolytic trap. MMPs operate here at up to 100 times normal levels, obliterating the extracellular matrix and destroying the cellular scaffold. Standard PRP releases 95% of its growth factors in a 6-hour burst, which are then quickly degraded in this hostile environment. Growth factors alone cannot fix a wound if the underlying biological scaffold is destroyed. For healing to resume, the physical architecture of the wound must be reconstructed. Protein-enriched PRP delivers the growth factors alongside the structural matrix that standard centrifugation typically discards. Fibrinogen polymerizes into a dense 3-dimensional matrix. This structure acts as a protective reservoir, extending growth factor release from a 6-hour burst to a sustained timeline of more than 12 days. Fibronectin binds to integrin receptors to enable cell attachment and directional movement. In chronic wounds, MMPs leave fibronectin fragmented. Protein enrichment replaces these molecules to restore the cellular migration highway. Alpha-2 macroglobulin, or A2M, inhibits proteases from all catalytic classes. It uses a venous flytrap mechanism to cage and trap MMP enzymes permanently, neutralizing the destructive environment. These 3 proteins work together to re-engineer the hostile wound environment into a stable matrix capable of supporting sustained tissue regeneration. This approach is validated by high-grade clinical evidence, starting with diabetic foot ulcers. This 2023 meta-analysis of 22 randomized controlled trials showed that protein-enriched PRP improved complete healing and shortened healing times by over 3 weeks. Most significantly, the data showed a 65% reduction in amputations. Based on this evidence, Medicare provides coverage for this treatment at $770 per application. The biological theory of matrix reconstruction is backed by top-tier clinical data in the most severe diabetic cases. We see the same success in stage 3 and 4 sacral pressure ulcers, where the extracellular matrix has been completely destroyed. In the Mizuko 2024 study, protein-enriched PRP achieved a 52% wound reduction in just 6 weeks, with 0 adverse events. Mizuko concluded that this specific approach, quote, ensures the complete and total collection of all PRP molecules normally lost during centrifugation. While these results are promising, we note this was a level 4 case series of 10 patients and utilized allogenic donor sourcing. Mizuko's research demonstrates that capturing the proteins normally lost during centrifugation successfully reverses complete tissue destruction. For venous leg ulcers, clinical evidence shows an 84% reduction in recurrence rates when using this method. In severe burns, research indicates a nearly 7-day reduction in healing time. The antimicrobial peptides in the application also drove an 82% drop in infections. This protein-enriched mechanism is a versatile biological approach that scales across multiple types of intractable wounds. Practitioners can deliver this biological solution in a clinical setting using the PCX system by Swiss Concept. The 15-minute process involves a single blood draw and gentle centrifugation, followed by ultrafiltration to capture the necessary proteins without discarding plasma. PCX utilizes the same ProteSmart ultrafiltration membrane technology validated in the Mizuko research. While the ultrafiltration method is clinically validated, the specific output parameters for PCX are currently projected and await head-to-head clinical trials. The system provides a technological bridge, allowing clinicians to capture essential proteins standard centrifugation throws away. Millions of patients currently fail standard wound care, leaving them at significant risk for amputation and high mortality. Standard PRP provides growth factors, but it fails to provide the protective structural scaffold needed to survive the wound environment. By utilizing specialized ultrafiltration, clinicians can deliver both the vital growth factors and the protective protein scaffold from a single blood draw. Rebuilding the matrix provides a way to escape the proteolytic trap and save limbs from the devastation of chronic wounds.